Hi, Dr. Eric Thomas for Nutmeg Dermatology, talking about a really serious condition that many people have. They come in concerned about it, obviously. Sometimes they've lived with it their whole adult life, and really, think there's nothing that can be done. Well, I'll tell you what can be discussed or can be done. May not have a cure for you, but I'm talking here about ingrown hairs, or often called hair bumps. They can occur in anyone, but they are more common in curly-haired individuals, or some people have hair that just grows at a really sharp angle. In other words, most hair, if this is your skin and this is the hair, if it's going like that, the hair doesn't usually get caught. But some people have hair that grows almost parallel to the skin. And again, curly hair grows back into the skin. So for those people, especially when the hair is cut close to the skin, it will penetrate the skin I should say, producing an infected area. More common on the shaved area of men, sometimes the back of the neck, especially in barbershops that shave it really closely. I believe way back when in the Vietnam era, this almost produced some riots, because one of the best ways to treat this is to let your hair grow just a wee bit, to let it get out so that the hair doesn't get trapped quite as easily. Well, this did not go over too well with a military concept of tightly or closely shaved face and hair and so forth. So people who had this problem really felt picked upon, and although it can occur in any ethnicity, it is a little bit more common because of the curliness of hair in people of color. So there were almost little race riots back then. So in any event, my advice to you is that to the extent that it's acceptable with your grooming, that you let the hair grow at least a little bit beyond normal. And actually, even if you do that, you'll still have an occasional problem, because hair is such that it will grow on average a year and a half, 2 years, then it will be shed, then there'll be a rest stage, and then guess what? It's going to grow back. So the new ingrowing hairs can penetrate again. Another technique that people frequently use is to use it, I'm not recommending this, but this is just what I know happens, is that they will use a very small needle to free a trapped hair. Also, infection does sometimes occur, so we do use rub-on topical antibiotics, sometimes in an alcoholic or a milky, creamy lotion, and that can seem to help. And finally, we do occasionally use tretinoin, which is an agent that softens the outer layer of skin and might be of some help. So this is a really short talk because I want to acknowledge it. I want to let you know that other people out there have it. Various companies have tried to bring out special shaving techniques, special shaving tools, and I certainly recommend you look into those. Maybe there is something out there that will help you, but at least consider letting your hair grow that little bit longer, and try not to get the last micrometer of hair. Anyway, hope this helps you. Eric Thomas, Nutmeg Dermatology, talking about ingrowing hairs and the pain that it causes a lot of people. Best wishes.